Welcome to Wednesday's edition of COVID-19. We've recorded well over 600 new infections today, following tallies in the 400s on Monday and 500s on Tuesday. Authorities are placing priority on COVID-19 testing and on public inoculations in hopes of achieving herd immunity this autumn. Let's start now with the pandemic updates. So there's been another surge here in Korea on this Wednesday.
Right, Sunny. Quite a load of new infections scattered across the nation, with 635 cases reported as of 12 a.m. this Wednesday. And with that, domestically transmitted cases have also risen to the 613, meaning 130 more cases compared to the day before. Now, that's raised the total here in the country to 128,918, and we've got 5 more deaths, raising the fatality toll to 1,884. Now, our daily figure has been rising the past days. On Monday, we started off with the 400s. On Tuesday, we went up to the 500s. Now we're back to the 600s. But that's not a big surprise, as we usually see a rise at around the middle of the work week after more tests are being conducted on Mondays and Tuesdays following the weekend. And if we compare Wednesday's figures for the past 5 weeks, we actually see a downward trend in recent weeks.
I see. And that finding, I understand, is raising hopes for relaxed prevention measures sooner or later.
Right, Sunny. Acting Prime Minister Hong Nam-ki did mention some improvement in the situation, also citing that there's been a decline in the reproduction rate of the virus in the past 4 weeks. So here's what's being considered.
The government's primary goal is to keep daily infections at a stable level below 500, and it is doing its best to achieve that. If this objective is realised and maintained, we will review our restrictions on business operations and private gatherings. Separately, we are also discussing revisions to our social distancing scheme at around July.
And some of those measures have already been implemented in some places of the country that are less affected by the virus, such as in places like Jeollanam-do province, as well as in Gyeongsang-Bukdo province here. But there are still very high risks, especially regarding the variant cases, which also the acting prime minister mentioned, especially with a higher presence of the South African variant now in Gyeonggi-do province, which reported 187 cases this Wednesday. The capital, Seoul, meanwhile, has hit above 200 infections this Wednesday. And on to our vaccination updates. So with almost 3.7 million people having received at least one shot of COVID-19 vaccination, that's around 7.2% of the country's population.
Right. Meanwhile, so I understand May 12th, that is today, is a rather meaningful day around the world.
Yes, Sunny, it's International Nurses Day. And amid the COVID-19 pandemic, nurses around the world deserve more praise than ever before. And that's also been mentioned by the president of the International Council of Nurses, Annette Kennedy, who said the pandemic has shown the important role of nurses around the world, quote, keeping people healthy across the lifespan. Let's hope that next year's Nurses Day will be easier on nurses when we return, or if we return to our daily lives. But a place where the coronavirus was not felt on Tuesday was in London at the 2021 Brit Awards, which was held with an audience of 4,000 fans with no masks and no social distancing. But what was needed was a COVID-19 negative result. And that is possible there because the UK, which has a total of 4.4 million infections, now has some 35 million people vaccinated for COVID-19. Meanwhile, in the US, with 33.5 million cases, now vaccination at subway stations is possible in New York City. Where all of that is not possible is in India, with 23.3 million cases, where almost 350,000 infections were reported in the span of 24 hours. And the total number of cases around the globe has now surpassed 160 million. And those are the updates I have for now. Back to you, Sunny.
All right, so thank you for that coverage. Right. Meanwhile, health authorities here have vowed to tackle the threat posed by variants via extensive analysis. The remarks were shared during a Q&A session with reporters following Tuesday's afternoon briefing. Our Abby Lee is here in the studio with details on that. Welcome back, Abby.
Hi, Sunny. As you mentioned, the briefing started out with the status of the new variant spread and what the government is doing to curb it. When compared to other health agencies abroad, the Korea Disease Control and Prevention Agency says it's taking a more aggressive approach in the analysis. Let's hear from one of the directors at the KDCD.
Health authorities have continued to strengthen its monitoring of variants from abroad by conducting more analysis on these strains. Most other countries have a goal of conducting genome analysis on at least 5% of their COVID-19 cases. But in the case of Korea, we have studied more than triple that number, or 15.9% to be exact, in the span of just 1 week.
From the DNA analysis of COVID-19 patients in the past week, 176 new variant cases have been detected. Now, of that number, 154 were of the UK variant and 22 were carrying the South African variant. This brings the country's total to 808 confirmed variant cases as of Tuesday, with UK variant taking up the majority, or 705 to be exact. The South African variant accounted for 93 infections and the Brazilian variant only 10 out of the total number.
I see. Now, Abby, as their name suggests, these variants are not native to the peninsula. Tell us a bit about their entry into Korea.
Sure. To answer the question, let's take a look at the numbers. So in the past week, a total of 176 new variant cases have been confirmed. Now, of the number, 35 infections were imported, detected either at entry or during quarantine. So that means 1 out of 5 cases have come from abroad. The remaining 141 cases were transmitted locally.
Right, then staying with the variants, Abby, what is the latest with regard to the situation in India and our efforts to bring home Korean nationals from that country?
Yeah, the numbers are actually looking quite hopeful. The Korean government has flown 540 residents in India back home in 3 separate flights since May 4th. 16 of them have been confirmed with COVID-19, but only 1 with the Indian variant. But the situation in India itself is not looking as bright. India has almost 23 million confirmed cases and more than 240,000 deaths reported so far. What's even scarier is that experts say the actual numbers could be 5 to 10 times higher than the official count. Cows are widely considered to be sacred symbols of life in India in the midst of the rapid spread of the COVID-19. Some worshippers are covering their bodies in cow droppings and urine, hoping it will boost their immunity against or help them recover from the coronavirus. Naturally, doctors in India are warning against such practices.
As per the literature evidence available and the various studies conducted, and there is no scientific evidence to prove the cow dung can be used as a treatment or immunity booster against the corona infection, which is prevailing.
Right. Meanwhile, back here in the country, Abby, what are Korean authorities opting for to prevent the spread of variants here on the local front?
So the agency has changed the rules and regulations at its screening stations around the country and also received a new batch of the Pfizer vaccines this morning. The vaccine shipment was announced during Tuesday's briefing.
438,000 Pfizer doses are expected to arrive on schedule Wednesday at Incheon International Airport as part of a separate contract agreement. With that, we have taken delivery of 2.87 million out of the 7 million planned shipment of Pfizer shots for the first half of the year. The remaining vaccines will continue to be delivered on a weekly basis without disruption.
The KDCA Commissioner Chung Eun-kyung said the agency will add more staff members at its port screening stations. It will change the work shift at the 4 busiest stations to allow for longer hours of operation. That's all for me today.
All right then, Abby, as always, thank you very much for that.
Thanks for having me.
Right up next, we bring you scenes from a special exposition here in capital Seoul that offers a glimpse of the advances thus far in the no-contact business model. We have details in this report.
With the COVID-19 pandemic, having a non-face-to-face system has become a must for many industries. According to a survey conducted by the Seoul Metropolitan Office of Education, 94% of elementary schools, 90% and 80% of middle and high schools are currently operating real-time remote classes. In addition, a survey conducted by a video conference company showed that more than 80% of respondents believe that online conference in medical, education, technology, and professional services areas will still be necessary even in the post-COVID era. The non-face-to-face industry is considered essential not even during the pandemic, but also even in the post-COVID era. Today, I am at a fair to look around a variety of products and ideas that people might find useful while working from home. A number of companies such as video conferencing, non-face-to-face work software, remote learning using IT technology, online security, and an online artwork trading platform participated in the fair. I met video conference and collaboration software managers, and these two sectors are the most essential ones when working from home.
이 코비드가 있고 나서 확실히 리모트 워크라든지 재택근무라든지 온라인에서 업무를 해야만 한다라는 환경이 좀 강제화됐어요. 최근에는 기존에도 고객들의 목소리를 많이 들었지만 좀 더 적극적인 고객들의 의견을 반영해서 실질적으로 회사에서 비대면 업무 환경에서도 업무를 이어가실 수 있는 기능들을 우선순위 있게 개발하고 있습니다.
What is concerning amid the rapid non-face-to-face technology development is that the form of cyber attacks has also evolved, becoming much more sophisticated. And there are some companies that are working on developing tools to counter such attacks.
쉽지만 인증에 강한 전자계약 서비스를 개발하게 되었습니다. 상대방이 서명한 시간을 제3자 기관을 통해서 몇 시 몇 분 몇 초에 서명이 되었다는 부분과 함께 위변조 방지 기능을 제공해 드립니다. 그래서 원본에 대한 문서도 보안을 강화시켰습니다.
VR companies attracted much attention too. Metaverse is a collective virtual shared space where your avatar can do activities such as working, taking classes, and even shopping. Also using an XR telescope, you can travel anywhere in the world.
우리나라에 지금 관광을 못 오지 않습니까? 해외인들이. 그래서 저희가 고궁이라든지 국내 유적지들 굉장히 많지 않습니까? 그런 고궁이라든지 유적지들을 라이브 데이터를 우리가 수집을 해서 해외에 있는 유저들이 들어와서 우리 고궁을 방문하고 K 관광을 좀 활성화할 수 있게 그런 환경을 제공하는 게 저희 라이브 메타버스입니다.
So what are the future prospects of the industry that experts say?
기본적으로는 언제 어디서나 모빌 이동성을 확보를 한다던가 또는 굉장히 유연한 근무 환경을 확보를 한다던가 이런 부분들 측면에서 비대면 커뮤니케이션과 이런 산업은 굉장히 활성화될 거라고 보고 있고요. 기업들이 꼭 코로나와 상관없이 비대면 어떤 업무 문화를 조성을 했을 때 인재 채용의 풀도 넓어지고 그리고 더 많은 직원들이 더 동기를 가지고 일을 할 수 있기 때문에 저는 비대면 어떤 산업이나 이런 서비스는 더 활성화될 거라고 보고 있습니다.
There are different opinions on the prospect of the post-COVID era, but people would still agree that the world would look completely different from the one that we used to live in. The non-face-to-face industry will evolve as time passes, and we look forward to more changes to come. This has been 신세벽.
And in this next report, we explore the medical phenomenon of breakthrough infections and its reality with regard to COVID-19. To take a look.
Over in the US, some 9,000 people have been infected, despite more than 2 weeks having passed after getting their second dose. These cases are known as breakthrough infections, which have also been witnessed in those vaccinated against chickenpox and measles. These latest reports are adding to the evidence that vaccines do not offer 100% protection against COVID-19. Vaccines may also be less effective in those with a compromised immune system.
이러한 감염 사례가 나오는 이유는 아마도 백신이 효과가 있더라도 개인적 면역에 따라서 재감염이 될 수가 있고 또 변이 바이러스에 의해서도 재감염 사례가 있다고 생각합니다. 백신 접종 후에 항체가 적게 생기는 분들은 대부분 어떤 면역 질환이 있거나 면역이 약한 분들, 그다음에 연세가 많은 분들이기 때문에 아마 재접종을 하셔도 잘 항체가 생기지 않을 것으로 생각합니다.
The emergence of COVID-19 variants across the globe have also led to questions on whether these mutated strains are more likely to cause breakthrough infections.
In theory, yes. However, it's important to realize the more people who become vaccinated, the virus gets pushed into a smaller and smaller space, and it has less room to come up with new ideas. So the virus can only escape the vaccine well if we give it a lot of chances to infect people, because it comes up with new ideas, new tricks by chance, by randomness. So if we limit the number of infections by vaccinating more, then we will be protected from variants. So the quicker people get vaccinated with good vaccines, the sooner we will crush the virus into a space where it cannot defeat us.
Despite the shortcoming, experts are still recommending people to get their vaccines when they're available. They say breakthrough infections affect only a negligible percentage of vaccinated people, and even then, vaccines can help lower the risk of serious illness and death.
You know, vaccines are very effective at preventing people from getting really sick and dying from COVID-19. And they also seem to be pretty good at preventing you from both getting infected after you've been vaccinated and then transferring that infection to others. It's not 100%, but it does require, depending on the type of vaccine that you're using, either 1 or 2 doses.
In light of the risk of breakthrough infections, vaccinated individuals must continue to exercise prevention even after getting their shots.
돌파 감염이 된 경우에는 누가 돌파 감염을 당하는지 사실은 모르는 거거든요. 그래서 백신을 맞았더라도 당분간은 마스크도 쓰셔야 되고, 그다음에 내가 다른 사람한테 옮겨줄 수도 있고 다른 사람이 나한테도 옮겨줄 수 있기 때문에 그런 부분에 대해서 방역 수칙을 당분간은 철저히 지키면서 이 돌파 감염에 대해서 좀 더 자세한 의학적인 데이터가 나올 때까지는 기본적인 것은 꼭 지켜야 된다, 그렇게 말씀드립니다.
Breakthrough infections, though concerning, do not diminish the importance of vaccines and prevention as our most effective tools in the fight against COVID-19.
(11월) 집단면역 달성 목표를 당초 계획보다 앞당길 것입니다. 집단면역이 코로나를 종식시키지 못할지라도 덜 위험한 질병으로 만들 것이고 우리는 일상을 회복하게 될 것입니다.
코로나19 바이러스는 토착하여 우리는 코로나 바이러스와 더불어 살아가야 할 것입니다. 그리고 결국 독감처럼 매년 코로나 백신을 맞게 될 것입니다.
Health experts have been debating the concept of herd immunity in recent days. Is it possible? And if so, what is its threshold for COVID-19? And if not, what is the end game for COVID-19? To answer these questions and others, I have Dr. David Kwak from Suncheon University Hospital. Welcome back, Dr. Kwak.
Thank you for having me.
And joining our session virtually is Professor Benjamin Koling at the University of Hong Kong. Pleasure to have you with us, Professor Koling.
Hi, good afternoon.
And Professor Peter Chin Hong at the University of California, San Francisco is also live on the line. Good to see you again, Professor Chin Hong.
Always a pleasure, Sunny. Thank you.
Right then, Dr. Kwak, before we delve into the actual debate, let's start with a definition of the term herd immunity.
Right, so I'm going to state out a equation here that might hopefully not confuse people. But by definition, herd immunity is 1 minus 1 over R naught. And if some people are familiar with the terminology R naught, it's the infection rate when a person or a viral container can, how many other people can one person infect. So if we estimate just in an assumption that if the virus can infect 3 other persons, that means we need to reach about 66% of the whole population to reach the level of immunity that people being infected will no longer be able to infect others without any further immunization per se. So it's a theory really, but we've also reached that level of immunity through smallpox. Smallpox was eradicated, let's say, through herd immunity. But in this sense, so originally, when we thought this particular virus, SARS-CoV-2, was able to infect 2 to 3 other people, that's why we were at the beginning saying we need to reach 60 to 70% of the population to have immunity against the virus. And then from that point on, it'll no longer be able to spread to any other people, even if those people were not immunized. But in reality, there are many other factors that are counting into this, such as variations, such as hesitancy to receive vaccinations, to even reach that level of immunization. So multiples of factors are also being considered. So the original sense of herd immunity, I think, is sort of being, I could say, maybe being changed, or it could be more adjusted to reality, I guess. So, but at least from the beginning, the theory of having herd immunity is reaching a certain level of population, certain portion of population immunized, so that others who are not immunized can also be protected from the virus.
Right. And now, having set the definition for herd immunity, Professor Cowling, what do you believe is the herd immunity threshold for COVID-19?
I think it's right that maybe somewhere in the 60-something% would be a good threshold to aim for. But please remember, that's the level of immunity in the population that we need for herd immunity. That's not the vaccine coverage we need. If we use a vaccine that's highly, highly effective, like the Pfizer vaccine that you have in South Korea, then with 95% effectiveness, you need to go maybe to 70% coverage. If you use a lot of other types of vaccines, a lot of AstraZeneca, a lot of inactivated vaccines that are less effective, it's actually tough to get the population immunity level up as high as the 60% plus. So it really matters which vaccine you use if you're going to be able to get to herd immunity. And also remember, a third factor is how many infections you've had. In Korea, I guess less than 1% of your population have been infected. But in other parts of the world, if they've had 10, 20% of their population infected, having some immunity from that, then that's also going to contribute to herd immunity. And they may not need such a high vaccine coverage as you would need in Korea, as we need here in Hong Kong, where I am.
I see. Does that mean, Professor Cowling, that infection-induced immunity may be stronger than vaccine-induced immunity?
That's not clear. It looks actually like the first infection may not give complete immunity against reinfection. We've seen a lot of examples of reinfections. And there's an analogy with the vaccines where you often need 2 doses of vaccination because it's the second dose that really brings your immunity up to a high level. And if people have already been infected, maybe they could just have 1 dose of vaccination to do the same thing to bring their immunity up to a much higher level. So one infection may not give complete immunity, but it may still contribute to some extent to population immunity.
Right. Meanwhile, Professor Chin Hong, at the start of the year, Dr. Anthony Fauci said that 70 to 85% of Americans need to be immune to COVID-19 to reach herd immunity. But at the start of this month, he cast doubt on his earlier remarks, claiming that we don't know what that number is. I believe, Professor, you share Dr. Fauci's current stance.
Yes, I certainly do, Sunny. So the reason why I don't think we'll reach to any level of herd immunity soon is because of the 3 V's. So the first is vaccine equity or lack of vaccine equity. Of course, as Dr. Cowling, Professor Cowling states, you don't only need vaccines, you can have some level of natural immunity together with vaccines. But the point is, because there's lack of vaccine equity, you're having one part of the world with large surges, another part of the world quiescent. By the time the natural immunity wears off, it's enough for another part of the world to have a flare. And because no country is an island, that's going to be very difficult. The second V is vaccine hesitancy. 1 billion people are estimated to be hesitant across the world. In fact, 30% of countries have less than 70% of their population saying they're willing to take the vaccine, particularly concentrated in the former Soviet Union countries, the Balkan countries, even some countries in the Caribbean like Jamaica with about 30% approval rating for the vaccine. So, this hesitancy is a really real phenomenon. I'm worried about it. And the third V, of course, is the variance. So in the old days, 70%, I'll be happy with that. But with these more transmissible variants, and as we continue to have little flares all around the world, every time there's a transmission, there's a possibility of creation of not just the variants we know about, but new variants that haven't been invented as yet.
Right. Right, then Professor Colin, keeping in mind what Professor Chin Hong has just said, what makes you or what keeps you optimistic about securing herd immunity despite the growing presence of variants and low vaccination rates?
I think we could look at the example of Israel as a place where there seems to now be herd immunity with 60% plus vaccine coverage, plus some immunity in their population from previous infections. Now, there may still be in the future a flare-up of COVID, but now that the vaccine coverage has reached that high level in Israel, I don't think COVID will pose as much of a threat as it once did. But that also reminds me that herd immunity is not a static level. It's something that changes over time. So it's true that we may get to herd immunity now, but it may wane away later if there's a variant comes in that's more transmissible that escapes immunity. It's something that may need to be curated. It may need to be managed with top-up vaccines, with booster doses, with vaccines against new strains and so on. But I do think that some parts of the world will be able to protect their populations by achieving herd immunity. Maybe not everywhere in the world. COVID's not going to disappear, but some parts of the world will be able to go back to normal sooner rather than later.
Right. Dr. Kwok, how do you respond to these two contrasting views with regard to herd immunity?
So I think it's the issue is really on the definition of herd immunity, what we expect to see when the herd immunity is reached. It seems like what we were really imagining is that when we reach a certain point, we will just go back to complete normalcy, the lives that we used to have before the pandemic ever began. But that might not be complete truth or reality to see in the future because, as both the doctors mentioned, the reality is the variance is still going to occur. There might be some evasions that we still might need to keep socially distancing. So I think also in what Dr. Fauci in the United States has mentioned in regards to this definition is that he specifically, quote unquote, said it's the definition of herd immunity is more elusive and mystical, meaning what we expect to see when the herd immunity is reached can be different according to different specialists and experts. So that being said, obviously, if we could reach a complete normalcy, complete back to what we used to have, would be ultimate. But if it's not so feasible, then the best alternative would be trying to manage the life as normally as we can. Probably trying to keep maybe socially distancing a little closer, or maybe having the mass gatherings that we used to have, maybe smaller in size, but still feasible. So the definition of herd immunity is not completely set yet. So the picture that we expect to see or we want to see should be sort of drawn and established from this point on, I guess.
Right. Professor Chin Hong, authorities in Sweden at the start of the pandemic spoke of herd immunity via infection. What do you believe was perhaps the reason behind their failed strategy?
The reason is very simple, Sunny. I think it wasn't appreciated what a high toll natural infection would take, particularly on the elderly. COVID is not a simple infection. It's not like getting a cold. You're risking people's lives by getting infected. We didn't have very good treatments. We still don't have very good treatments. And so that when people get natural infection, it's like playing virus Russian roulette. You don't know who's going to get very, very sick. You don't know who's going to have a mild case. So this made the reality of Sweden the third highest country per capita in terms of deaths, 10 times more than Norway and 3 times more than Denmark, their neighboring Scandinavian countries.
Meanwhile, Dr. Kwak, authorities here in Korea forecast that herd immunity may be reached sooner than November on the local front. What are your prospects?
So I have to carefully say that that statement is sort of premature at best. As of now, as the doctor mentioned, we don't know 100% of how the virus is going to act. Once a person shows up with the symptom, it's already too late because that person might have infected others. Also, we have no idea how that disease, particularly on the person, will progress. That person may become severe, or that person just may pass without any specific symptoms. So the forecast, we have to take the most conservative approach to this as much as possible. I don't think it's the, as a professional, I don't think I can professionally say that, at this point of time, we will reach herd immunity and everyone will be safe to go. I think more appropriately, I could say that we still need to do our best to mitigate the virus as much as possible. And when we do all these, we might be able to reach a certain level of freedom from the virus and the worries of the virus. So, me carefully stating that reaching herd immunity for our own country, I don't think the government should be taking steps ahead or taking guesses ahead, but we should still trying to keep the mitigation as best as possible.
Right. Professor Cowling, COVID-19 vaccines, including those by Pfizer and Moderna, have been found effective in preventing illness within those who have been vaccinated, but their role in preventing transmission among people remains relatively unclear. What are your thoughts?
I think, again, if I can mention Israel, that the example there indicates that indeed by preventing mild infections, the vaccine is also going to be effective in limiting transmission. There was uncertainty in the early days over whether there might still be breakthrough asymptomatic infections which could be contagious. Now there seems to be more and more evidence that that is not the case. And so we can rest assured that the mRNA vaccines will be able to prevent the majority of transmission that would have otherwise occurred. We don't know whether it's 95%, 90% or something else, but it's certainly going to be a high level of protection and prevention of onwards transmission.
And Professor Chin Hong, what are your thoughts on the issue of transmission of COVID-19 via, post-inoculation?
I agree with Professor Cowling. There's really good evidence on the countrywide level now that at least when you use the mRNA vaccines, that it also prevents transmission with a proxy of preventing asymptomatic infection, because those are the people most likely to transmit. I am worried, however, that not all vaccines in the world are mRNA vaccines. So that leaves the question of what would happen with the Sinopharm or Sinovac and other vaccines as well in terms of that prevention of transmission.
Right. Dr. Kwak, given the presence of such debate that we're having on herd immunity at the moment, some may question the purpose of COVID-19 vaccination. How do you respond?
Well, there's no question about it, really. For me to say, vaccine is probably the only tool we have at hand right now to fight against the virus that can possibly mitigate the spread of the virus and further, and maybe possibly reach eradication or the end, as you said, end game of this whole pandemic. We don't have any other tools at this moment. We don't have the curative treatment. We don't have manageable treatment other than steroids to sort of appease or ease the symptoms of the people who are having it more severely. So people who are having the idea against receiving vaccinations, I think at this point, they need to be corrected. I'm sorry for using much harsher terminologies here, but vaccine is the only tool that we have currently to fight against the virus. So we need to get everyone, as much as possible, the population, to have vaccinations.
Right. And Professor Cowling, what are your words of advice with regard to securing herd immunity against COVID-19?
I think if you look back at the past year in Korea, elsewhere in the world, we've had to do a lot of social distancing to stop transmission. I think regardless of the threshold for herd immunity, whether it's 60, 70% or higher, if you can get a higher and higher vaccine coverage, go from 10 to 20 to 30 to 40 to 50, every step along that pathway makes it easier to control COVID with maybe less social distancing, less other measures, less quarantines, etc. So the pathway to herd immunity is going to make everything easier, even if we can't return to normal until we get to that high level of vaccine coverage. I think in Korea, hesitancy is going to be an issue, as we've heard about. There are going to be issues with variants as well. But higher and higher vaccine coverage is going to help a great deal in getting back towards normality, at least.
And what has been the response to vaccines in Hong Kong, Professor?
So far, we have 13% of our population having received at least one dose. And the vaccination program here is running out of steam. Vaccines are now available to all adults. You can book an appointment, go and get it the next day. And there's not an enormous amount of take up of vaccines. We're kind of struggling through, wading through deep water to try and persuade people to go and get vaccinated. The government's thinking about introducing vaccine passports, which were used very successfully in Israel, but it's a controversial topic and there's issues with equity and other factors as well. So I'm not sure what's going to be the solution here, but we're aware that until we get that high level of vaccine coverage, we're going to be stuck with the quarantines, with the social distancing, with the universal masking and other things as well. So we really want to see people choosing to get vaccinated so that we can get on that pathway towards normality.
Right. Professor Chin Hong, what do you propose as the ultimate goal in the global fight against COVID-19 then?
Well, Sunny, I think the ultimate goal is really to have equity in my perspective. And equity isn't just good for humanity and good for the soul. It's the only way we can all have protection at the same time so that we don't have this asynchrony. It's like a heart trying to beat, but the muscles are beating at different times. So the heart isn't pumping the blood. I think I agree with Professors Kwok and Professors Cowling. I think hesitancy is a big issue, but at the end of the day, as an infectious disease doctor, if the vaccine prevents me from getting very sick, it prevents me from going to the hospital, using the ICU, that is a big success.
Right. Meanwhile, Dr. Kwok, what should be the objective for Korea in its battle against COVID-19 then?
Well, at this point, everyone's worried that the vaccines that government has claimed to secure either will or will not reach our soil. We have seen a couple of, not couple, but tens of thousands of vaccines that are supposedly arriving on our soil either tomorrow or the day after. So I'm glad that they are actually doing that. But we need to get many, many more vaccines, not just secured theoretically, but they actually need to arrive on our soil to reach as much people. We need to get not just the elderly vaccinated, but all the other people who can be just walking around, who can also be affected from the virus, all vaccinated. For example, in the United States, they have already begun thinking about inoculating people between 12 to 18 years of age. We also need to start thinking about that. We need to reach as much of the population as possible with the vaccines, and in order to do that, we need to have those vaccines on our soil. Be ready.
Right, which is something we've been talking about this entire program, the availability of vaccines, as Professor Chin Hong has also pointed out. Professor Cowling, keeping that in mind, the fact that vaccines are not available to all countries across the globe, what are some ways of dealing with this issue, do you suppose?
I think what we've learned is that we need to increase manufacturing capacity quite drastically, and I'm disappointed that hasn't already been done. I know now there's discussion about relaxing the patents, but that may not help, because one of the bottlenecks is actually the raw materials that go into the vaccines. So even if places in other parts of the world can start manufacturing Moderna vaccines, BioNTech vaccines, maybe the limiting step is the amount of raw materials, not necessarily the patent. So I think increasing manufacturing capacity is really critical. Even now, it would make a big difference in the coming year.
Professor Chin Hong, what are your thoughts on the Biden administration's recent shift in stance with regard to the lifting of patents, as Professor Cowling has just mentioned, as a medical expert yourself, Professor Chin Hong?
I welcome it with open arms. I think we need this kind of initiative. But as Professor Collins says, it's not enough. There are other strategies as well. The U.S. purchased more than 1 billion doses in Operation Warp Speed. I think there could still be a lot more in terms of actually giving vaccines pre-made to the rest of the world. The second thing that they can also do, in addition to patents, is contribute more to COVAX and to WTO and all these efforts to fund the purchase of vaccines from middle and lower income countries. And finally, as Professor Cowling alluded to, giving the recipe for the cheesecake of like a vaccine isn't enough. You have to get the materials for the cheesecake. You also have to have the master chef show you how to make the cheesecake. So it's not enough just to release the patent and the recipe. You have to have the materials and the know-how, the information transfer of technology to really make this work.
Professor Chin-Hong, you mentioned vaccine hesitancy earlier on. What incentives are there in store for people in America if they get vaccinated?
So it's a combination of a carrot and a stick. The carrots are things like a free donut if you got a vaccine, or certain events, sporting games, where there's a vaccinated section and a non-vaccinated section, and you have more freedom if you get vaccinated. So that's kind of an incentive for people to get it. Of course, there's also money. So a study was done showing that Americans would likely take $100 to go and get a vaccine if they were more hesitant. Then there are the sticks. So I think that probably the biggest stick is the school requirements. So many colleges and universities are requiring vaccines for fall or autumn admission. That's in the University of California and the university state system in California. That's more than 1 million people already. And employees are also mandating vaccines in some situations. So I think a combination of a carrot and a stick, not one size fits all, is probably going to be the solution.
And Professor Cowling, what are your thoughts on the implementation of such a carrot and stick policy in Hong Kong, perhaps, to boost public inoculation against COVID-19?
There was a brief discussion about requiring vaccination for our foreign domestic helpers. We have 370,000 foreign domestic helpers from the Philippines and Indonesia, but there was a lot of concern about that suggestion, and it's been withdrawn. So right now, we don't have any mandatory vaccination policies in the pipeline. In the future, that may happen for healthcare workers, maybe for some other groups as well, but not now. And there's not a lot of carrots here either. So I think I personally prefer the idea of using carrots to incentivize people to get vaccinated. And what we've heard about is things like passports, allowing quarantine-free travel, allowing exemption from quarantine as a close contact if you're vaccinated, and maybe some other incentives as well. And I hope that that kind of thing would be enough to improve the vaccine uptake, because that's really the ultimate aim.
Right. And Professor Cowling, what are authorities in Hong Kong doing to prevent the spread, or further spread, that is, of variants in that country? In that place, of course.
Right now, we have very strict on-arrival quarantine. We have 21 days quarantine, actually, because in the 14-day quarantine, there were some people that came out of that and then had incubations that were longer, maybe day 18, day 19. So now we have 21-day quarantine. Now, actually, we have some people showing up day 24, 25. And I'm a little bit worried that that might be evidence that there's been a little bit of transmission after arrival when they're in the quarantine facilities. But we have these very strict on-arrival quarantines, which are hopefully going to be able to keep the variants out of Hong Kong for some time longer.
Right. Dr. Kwok, what looks to complicate Korea's efforts then to control its current outbreak?
Well, personally, I really want to blame the media at this point of exaggerating too much of the side effects from the vaccines. And if we look at it realistically, the vaccine side effects that are showing up might not even be actually due to the vaccines. And also some of the numbers are just completely being exaggerated. So we need to really focus on showing the right objective picture of what really is going on, so people have better idea of how to make the decisions for themselves to receive the vaccines. But media has to do its role in showing the examples of what countries has done well for this and what has been done for the people who has received the vaccines. So I think that could maybe changed a little bit in our country right now.
Right, and keeping in mind what Dr. Kwok has said, Professor Chin-Hong, do you believe the media in the US perhaps is responding properly perhaps to the pandemic?
Yes, I do think so. The media was crucial in the United States, particularly in the past year when we had a different political administration and there were a lot of mixed messaging from the top. So the media was really bringing and amplifying the voices of scientists and healthcare professionals like myself to really speak at the community, because the CDC wasn't having a very loud voice. We had to all share information ourselves. We had to dispel a lot of myths. We had to say what the messaging should be.
I see. All right, Professor Chin Hong and Professor Cowling, thank you very much for your time and your thoughts and for taking my impromptu questions today. And Dr. Kwok here in the studio, thank you very much for your insights.
Thanks for having me.
Right, despite the debate on herd immunity, one common hope within all of us perhaps is a return to normality in the near future. Thank you for watching.